Many people struggle with the complex conditions like diabetes, heart disease, and high blood pressure. That is why Dignity Health St. Joseph's Hospital and Medical Center launched their new Cardiometabolic Clinic in late 2025. And joining us this morning to talk more about the clinic is family nurse practitioner, Ms. Suzanne Sewell. Thank you so much for joining me this morning.
Thank you so much, Daryl, for having me.
So we got to learn a little bit about cardiometabolic and what that all encompasses, and why does Dignity help support this cause?
Yeah, great question. Cardiometabolic health is really kind of a buzzword, or a cardiometabolic clinic within our community and actually nationwide. More patients have cardiometabolic syndrome than they even realize. So cardiometabolic health is really disease processes that altogether increase your risk sometimes 4 times for a cardiovascular event, meaning heart disease, stroke, peripheral vascular disease. So cardiometabolic syndrome is criteria that you have to have 3 or more of different symptoms and or disease processes. So 1, high blood pressure. We have new guidelines for hypertension. Blood pressure greater than 130/80 is now considered to be high blood pressure, okay? Elevated cholesterol levels, so that could be triglycerides, or those fatty particles in your blood. As well as a low HDL, which we used to think was cardioprotective, as well as obesity, abdominal obesity. So for women, it's greater than 35 inches around the waist, and for men, it's greater than 40. Between all of those symptoms, increase your risk for heart disease.
And Ms. Suzanne, we were talking about those stats. Can we hit on those stats when it comes to the women and men? Because those were shocking to hear.
Yeah, so 1 in 3 women actually die of cardiovascular disease annually, more so than in breast cancer. Cardiovascular disease is the #1, sadly, killer of women. 1 in 4 men in the US actually die of heart disease. And probably a third of our US population have what we just talked about in metabolic syndrome.
And what is that journey like for patients who are coming to a cardiometabolic clinic?
So I think a couple things, right? Like a lot of patients are self-referring, which is great because they're reading a lot more about this. You see commercials, you know, for different drugs on television, right? And so they're coming. We're also being referred, you know, a lot of primary care physicians, endocrinologists, even, you know, an orthopedist or a pulmonologist who see certain conditions in patients may refer to us. Sometimes when I see patients, actually, it's really shock, right? Because I may be the first person that's telling them, hey, you know what, like we need to work on these things, right? We have high blood pressure. Some people are still in the community thinking like, oh, I don't have hypertension. Well, are you on medications? Yes, well then you have high blood pressure. Or, you know, oh, my labs, my lipid levels are normal. Well, let's break those down and really see where you are so that we can prevent, right? Our primary goal at Dignity Health Medical Group in cardiology is prevention of cardiovascular disease.
And I feel like we're seeing a rise of obesity, high blood pressure.
Yeah.
What do you hope for patients to get out of really finding out about a cardiometabolic clinic and what that can do for their lives?
So #1, increase their life expectancy. So if you have 2 or more of those symptoms that I just talked to you about, like elevated glucose greater than 100, if you are on diabetic medication, like I said, high blood pressure, it increases your risk for cardiovascular disease 4 times. 4 times. That's traditionally 8 years off someone's lifespan. That's a lot.
That is a lot. Suzanne Sewell, thank you so much for all the
You're
work that you are
welcome.
doing and the incredible team at Dignity Health, because you guys are
Awesome.
changing lives. And
Yeah.
definitely this information is going to help so many people
I
who
appreciate you.
didn't know there was a space for them to go to get all these things checked out.
Yeah, absolutely.
So thank you so much.
Thank you.
And if you guys would like to learn more information about Dignity Health and how you can book your appointment, you can go to the website or call the number you see on your screen.